followers and admirers, and thank you. Welcome once again to this interesting discussion. It's going to be an interesting discussion. Do get your pens and papers ready because you are going to live here with a lot more knowledge than you joined us with, okay? My name is Regina Williams. I'm a New York-based family nurse practitioner, and this morning I'm going to talk to you about COVID-19. The reach out is especially for the healthcare workers, what you should do, how you should take care of yourself, what to expect, what to look forward to. And the rest of you joining us will also take a thing or two away from what we're going to discuss, okay? All right. So, for introduction, okay, like I said, my name is Regina Williams. I'm both licensed as an FNP, that's a family nurse practitioner, as well as a registered nurse, okay? As a family nurse practitioner, I work with other NPs under the supervision of a doctor to gain hours towards independent practice. As a registered nurse, I work in batches of contracts on the hospital units. In both offices, I do direct patient care, all right? So I do a lot of teaching, community health reach programs, and what have you. So without wasting much time, let's jump into COVID-19, which is the virus that is responsible for the pandemic the world over. What is the pandemic? A disease that has crossed borders, crossed continents, is affecting the whole wide world. COVID-19 has us in a standstill. And we have to do all we can to survive it together. Okay, so let's jump into surviving COVID-19. All right, what is COVID-19? COVID-19. The CO stands for corona, VI stands for virus, the D stands for disease, and the 19 stands for the year it was discovered, right? So its official name is Severe Acute Respiratory Syndrome Coronavirus 2, and it causes the COVID-19 disease. How does it cause the disease? All right. When you pick up the virus through touching things, or somebody sneezes on you, somehow it gets on your mucous membranes in the eyes, or it gets through your nasal passages to your throat, or it goes through your mouth into your throat. It goes down into your lungs, all right, and it attaches itself to the cells of your lungs. The virus takes over the cells and makes the cell produce millions of its DNA, and the cell dies. When the cell dies and bursts, it releases tons of viruses into your system, okay? And these viruses wreak havoc on the ability of your lungs to exchange oxygen and let out carbon dioxide. It wreaks havoc on the ability of your blood cells to carry oxygen and supply the rest of your body. And this results in so many symptoms that we're going to discuss, okay? What are the symptoms you notice when you have a COVID-19 infection or when you have been exposed to COVID-19? The first symptom you're going to notice is like a sore throat, okay? Why are you having a sore throat? This is when the virus is attaching to your mucous membranes behind your throat, in your nose, and all, okay? Then you're going to develop a temperature because your body is going to mount a counterattack trying to take care of this virus, trying to get rid of the virus, okay? So you're going to have a temperature. The temperature is a sign of, one of the first signs of infection, okay? After the temperature, when the virus continues to multiply in your system and affect your lung tissue, you're going to have difficulty breathing. This is why we notice the shortness of breath and the chest pain, okay? When you have difficulty breathing, it means that the oxygen delivery to the rest of your body has failed or is failing. And when that happens, you start to notice pain. When oxygen is not delivered to tissue, your cells start to manufacture lactic acid, trying to make energy for themselves, for their use. And when they do that, the lactic acid causes a lot of pain in your system. So you notice a general body malaise. Oh, I feel like a truck hit me. Oh, I can't walk. I'm feeling pains in the joints. That is what is going on. Okay, your body is reacting to the invasion of this virus. Okay, now it also tries to get rid of the fluid that has settled in the lungs, because the lung cells and the tissue will release interleukins and all those things that is trying to fight the virus, and these things will settle as fluids in the lung tissue. Okay, so you find yourself coughing, trying to expel this collection of fluids. Okay, so when you notice these symptoms, excuse me, I hope it's not COVID. When you notice these symptoms, self-isolate, especially if you have a temperature. Please self-isolate. I shouldn't laugh. COVID is no laughing matter. Okay, self-isolate. And when you self-isolate, make sure you take your temperature every morning and evening. Okay, why are you doing that? Because you want to make sure, or you want to see that your body is fighting off this virus and you are on the mend. Okay, the first sign towards recovery is that your body is able to normalize its temperature. Now, if you're having high fevers, to protect your brain and body systems, you must take Tylenol, okay, to keep the fever under control, because you don't want your brains and all that to burn out. All right. Drink a lot of fluids while in isolation. Okay, what fluids do? They loosen up the secretions, they make it lighter, and they make it easier for your body to cough it up. Okay, cough syrup. Use cough syrup, lozenges to help with the sore throat. Cough syrup, expectorants. Expectorants will make you cough up whatever buildup there is in your lungs. Okay, steam vaporizers, the thing that our grandmothers used to do. Steam vaporizers, cover your head with cloth and inhale steam. People think that the heat from the steam will kill the virus, because the virus is very sensitive to temperatures. Okay, it will die with exposure to high temperatures. All right, so use steam vaporizers. What it will do, it will also help loosen the secretion. Okay, all right. Wear a mask. Wear a mask, please. If you're living in a house with people, wear a mask so that you don't cough and the droplets land on things around your house, or you don't expose. That way you don't expose people who are living with you to the COVID-19, to a possibility of COVID-19 infection. Now, when you're in isolation and you notice that you're having severe shortness of breath, severe chest pain, please call 911. Come into the hospital, okay? Now, on your way, give us a call that you think that you've been exposed to the COVID and you're headed over, so that we can get everything in place for you, okay? The protocol in the hospital these days is that we treat everybody as though they were COVID-19 positive, right? So before you even get there, we're all set and ready for you, all right? I would like to take a minute to talk about those people with pre-existing conditions and underlying factors that may predispose them to contracting the COVID virus. If you are obese, you find that those people who have obesity are more susceptible to a COVID-19 infection. Why? Because your bodies are already suffering a condition that, is called hypoxemia. That means that they are already not able to retain enough oxygen in their system. This process, scientists are still trying to understand, but people who are obese are predisposed to contracting COVID-19, and they suffer serious consequences when they contract the disease. People who have high blood pressure are also predisposed to COVID-19, and they have serious side effect if they have that infection. Why? Because the virus attaches to that part of your lung tissue that produces the hormone that will help regulate high blood pressure. So now, if it attaches there and you already had hypertension and high blood pressure, you are, or you will be, in bad shape, okay? If you have diabetes also, it's a problem, because diabetes wreaks havoc on your blood vessels. Your blood vessels carry oxygen to the rest of your body, and if it's unable to do so already, an infection with COVID-19 is not a good thing. If you have cardiac issues also, it's a problem. So when you're coming to us in the hospital, this is the point I want all the healthcare providers to join me. Send in your question, make your comments, and share knowledge, okay? When you come into the hospital, depending on Depending on the state you are in, we will triage you. We're measuring the amount of oxygen in your system, and the doctors will determine how far you have gone in the, in the disease, the effects of the disease on you. They are going to ease work of breathing, meaning that they'll start oxygen therapy, okay, to restore the levels of oxygen in your system, and then do whatever they have to do to stabilize you and send you to us on the unit, okay? All right, before I go there, let me talk to the healthcare practitioners, the frontliners, the people who drive the ambulances, the EMTs, and all that, okay? PPE is a lifesaver. PPE is your personal protective equipment, and it is a lifesaver. You got to know how to put your PPE on, because if you don't protect yourself, you'll fall ill. And if you fall ill, who will be there for the patients, right? So PPE is very, very crucial. You must make sure you have your mask, okay? How does this how is the virus transmitted? There's so much we don't know about the virus yet, but as we get new knowledge, we adjust our personal protective equipment to better protect ourselves. We know so far that this virus is carried in droplets, okay? It's spread by droplets. So when somebody coughs, it aerosolizes the virus in the air. So if you are in that vicinity, you are going to breathe it in and, be exposed to the infection. This is why they say social distancing. People, it's up to you. It's either 6 feet apart. If you don't know what 6 feet is, put your hands, like, can you see my hands like that? I'll stretch it both sides. Put your hands out there, 6 feet apart or 6 feet deep. It's up to you. Okay, so now we know that the virus is spread through droplets, and we practice our social distancing. If you're sick and the EMT comes to pick you up, you must have your PPE on. Start with the N95. First of all, they used to tell us that it's just droplet. We need to wear the ordinary surgical mask. But now they found out that it is important. It could be aerosolized, and it can live in the air for 3 to 8 hours. So we must have our N95s on. N95s prevents the transmission of smaller viruses. It really helps protect the first responders. All right, so you have your PPE on, you have your gloves on, you have your gown on. Okay, all this will help protect and break transmission of virus to you. Don't forget to cover your hair, because it's been found out that this virus lives for different lengths of times on different surfaces. Okay, so don't forget to cover as much as you can cover. All right, so use your hand sanitizers before you put your gloves on, and then don on your PPE. Wear your masks, okay? Wear your mask. Now, for those people who work on the unit, remember, when you are using the high flow, okay, the high flow machine aerosolizes the virus. It spreads the virus in the air. So when you are going into a patient's room and the patient has a high flow meter on, please use your N95. Don't forget that, okay? The face shield. Why do we wear face shields? Because it's also been discovered that if the virus lands on your eyeballs, right? If somebody coughs it up and it lands on your eyeballs, it's a way that it could also be transmitted, all right? And finally, take a deep breath, okay? Tell yourself you are adequately protected. Approach your patient and deliver the best health care that you can deliver to your patient. So now let's take ourselves back. Let's rewind. The patient has come to the hospital. She has been triaged. He or she has been triaged at the ER and has been sent up to us on the unit. So now we have used our hand sanitizers. We have put on our gowns, tie everything, cover what you can cover, cover your hair, all right? Put your mask on, your N95, and use your face shields, all right? And finally, put on your gloves, take a deep breath, and go into the patient's room. Remember, the COVID-19 is a very lonely disease. It's a very lonely experience, to have. It's intense in terms of caring for your patient, and it's very lonely for your patient because they are allowed no visitors, they are allowed no family members, so they are on their own. And the nurse, as usual, would be their first advocate. So you have to be there for yourself and be there for your patient. All right? Okay. I was asked to talk about our mental health as healthcare providers. I would like to smile and tell you nice things, but when we have opportunities to commune and share knowledge with each other, it's important to be as truthful as you possibly can. All right? Okay. There is high anxiety when it comes to caring for COVID patients because you don't know how you are exposing yourself. You don't know if you would take something home, and we all have loved ones. We have our husbands, we have our children, we have our families with us, and it will be a terrible thing, a tragedy to work to save others' lives and then bring the virus home to your people and hurt them. This creates very high anxiety, but you have to have faith that when you have, put on your PPE properly, you are protected, and and you are in a position to deliver the best care to your patient. All right. Now, before you see your patient, take a deep cleansing breath. Remember what they were teaching us in school? Deep cleansing breath, and know what you're going to deliver. All right. Reduce the number of times you have to run in and run out, running and run out, because as you wear your PPE and as you take it out, these are all avenues for exposure. Plan your day with your patient. He's getting medications maybe at 10. You see him again at 12, and then you see him again at 6, and then you round up. Okay? All right. So whenever you go in to see your patient, do everything you can for your patient. Everything. Make them go to the bathroom. Make them make sure that everything that they might possibly need is available to them. And this way, you reduce the times they live on the call bell. Having said that, people who are frightened and anxious will live on the call bell. Soon as you turn around, they're going to say, I need this, I need that, I need this. All that is fear and loneliness and high anxiety on their part. So we as healthcare providers should, learn to be a little more patient and a little more understanding with our COVID patient. Now, what do you do when you lose a patient? You do all you could do. You have delivered the best care, but your patient dies. And what do you do? First of all, remember this person is on his or her own, okay? You cannot reach the family. They cannot talk to their family, so it's just you and the patient. Now, what we have done on the unit is to organize like Zoom meetings, right? We log into Zoom and facilitate conversation with the family, especially at those last moments when the patient is passing. The family will be able to talk to the patient, and the patient will be able to talk to the family through Zoom. Thank you, Zoom. This is very important. Sometimes there's some people who don't have family, and it has to be just you and them. And then you stand there and you hold your patient's hands, and they pass. And if your patient was a Christian, you say a little prayer, or maybe sing a little hymn to help them. But it's always a difficult thing, when your patient passes. I was tearing up there for a minute because it's difficult. So I would like to encourage our nurses to take time out and speak to somebody, okay? Take time out and speak with somebody for your own mental health, for your own well-being, because, when you see too many deaths, when you tag too many toes, you kind of get jaded, You find yourself saying, oh, okay, he has maybe 2 more hours, and they're still alive, oh, okay. and you wonder, what am I becoming? Yeah, what is happening? What is going on? I would encourage all nurses to seek out some kind of therapy, okay? Seek out some kind of therapy, because these experiences of people dying left, right, and center is destabilizing, yeah? And it's like PTSD. Take time out for yourself, because if you are not there physically and mentally for your patient, all is not going to go well. You are that one advocate the patient has between this world and the next world. So you have to be there, body and soul. Okay? All right, now let's talk about how you are going to take care of your mental health in these COVID times. I researched that, and I'm going to go through it with you, okay? Now, there are three groups of people, three stages, okay, of surviving these COVID times. There is a survival stage, there is the acceptance stage, and there is the growth stage, all right? In the survival stage, we are scared of the unknown. We are glued to the TV, listening to what is going to be said. Where is it coming from? Who has died? How many people have died? Are we in danger? We are scared, okay? Now, the acceptance phase is learning to accept, right? Learning to let go of what you cannot control, getting to grips with tech, right? Communicating with your loved ones, learning technology. I had to learn that so that I'll be able to communicate with my loved ones, okay? Savoring the little things. At this point, I'd like to say thank you to all the Instagram entertainers. Thank you, Mr. Falls, for Bob Daddy. That was fun, okay? This helps us unwind. This helps us take our minds off COVID, okay? Now, from survival, you get to the acceptance mode, and then you get to the growth mode. You feel calmer, you can be patient and kind to yourself, you feel more joy, and then you look forward to when COVID will not be here anymore. I quite enjoy reading a lot of things on Instagram where people are talking about what they're going to do after COVID. As for me, oh my goodness, there is no song I will not sing, and there is no dance I will not dance when COVID is over. All right, so may God have mercy on us all. So we will be here post-COVID to celebrate. All right, now let me take a minute to talk about the economics of COVID. Can you imagine? The world has, stood still. Nothing is going on anymore. Economies are crashing. So many people are out of work. What are we going to do? Now, people back home in Africa, remember, most African economies are run on oil sales. Now there's no more oil. Okay, there is oil, but who is buying? Nobody's going anywhere. Nobody's driving any cars, but who's really buying oil? Factories have shut down. A lot of people are out of work. So what are we going to do? What are they going to do in terms of making a living? This problem is ballooning. It's bigger than we see. For how long is this quarantine going to go on? How long will people have to be indoors? How long are people going to afford to stay off work? Now, people say, oh, okay, this is when we really need that Western Union. But sad news, so many people out here are out of work as well. So many people out here are on unemployment. The government subsidizes when you don't have work, but that's not enough to really take care of your needs. So what are people going to do? It's a problem, Those of us that still have jobs, that still go to work, we worry if we're going to survive it, if we're going to catch something. There's so many facets of COVID that create high anxiety, but we have to be there for each other at this time. We have to be able to pull through, help each other pull through, okay? I would like to take this minute to say a big thank you to all the people who have been reaching out and giving back to the community. To all the people who have been crediting accounts, okay? I've been seeing that going on. From myself, I would like to remind the women and girls of Ukanafon, of Ikarikbat in Ukanafon local government area of Akwa Ibom. Reach me, okay? I'm here for you. I'd like to remind my superstar chefs, reach me, I am here for you. And I'd like to remind my nurses, all of you that I worked with when I came to Africa, out, okay? Reach out. I am here for you. I am not comfortable posting, what you do to help people. Other people might not be comfortable seeing their names out there as recipients or beneficiaries of these things. But if I post anything of your identity, I just want to say I appreciate you. Thank you for working with me. I love you. I care. All right. So reach out. Don't suffer in silence. Reach out. Speak up. Okay. I would like to thank the government, the Lagos state government, for providing all those palliatives for their people. And I'm waiting for my people in AKS to do same. All right. If you need information on COVID, if you need an action plan on COVID, please reach out, okay? I am here. We are all in this together, and we have to help each other survive this, okay? Now, before I close, I hope that I can close and I don't have to stay for 1 whole hour. Before I go, let's talk about palliatives. What are the things you must have at home? Please. Listen, what are those things you must have at home? Food staples. I'm trying to cover my glasses because I sat on it and it broke. Okay. You have to have staple foods. The gari, the beans, the wild rice, you must have it at home. Okay, staple foods. After that, the oil, the crayfish, the dry fish. I'm not going to talk about meat, okay? Please stay away from meat. Stay away from mucus-producing foods, okay? As much as possible, stock up on fresh fruits. Fresh fruits are chock full of vitamin C. Vitamin C is one of the treatment protocols we use, okay? It's very important to stock up on vitamin C. Buy it from the pharmacy. Take at least 2,000 grams every day, okay? 2,000 milligrams of vitamin C every day is very important. All right, our treatment protocol, nobody really knows how to treat this virus, okay, but we are using in the hospital the hydroxychloroquine, and we're using the azithromycin that President Trump has been touting, and somehow we are discharging people. They're getting better, and we're discharging people, okay. Stock up like on the foods I mentioned. Let me say it again: gari, beans, wild rice, crayfish, dry fish, okay, a ton of fresh fruits because they contain vitamin C. Use natural seasonings, all right? The garlic, the ginger, the lemon, the lemongrass. Drink a lot of sorrel tea. We call it zobo in Nigeria. Drink a lot of sorrel tea, okay? And go to your vegetable patch. Plant a lot of ugu and a lot of water leaf, all right? Sprinkle it in your foods, you will be okay. For isolation, you need the face mask, the thermometer, the Tylenol, the steam treatment, and everything we have discussed before, all right? Maintain social distancing, 6 feet apart or 6 feet deep. The choice is yours. If you want to get out of COVID, okay, if you want to stay alive after COVID, please, social distancing. Hand washing. Use your hand sanitizers or wash your hands, okay? Use bleach to spritz on your, this COVID is some kind of exam on how we have been on top of our hygiene or how we have not been on top of our hygiene. Wash your hands. Nobody has to tell you. Nobody should have to tell you to wash your hands, okay? All right. So get your bleach, spritz it around. Those people who don't have face masks, please use a piece of cloth. Cover your nose and cover your mouth, all right? Stay away from people who are coughing and sneezing. You know what happens? This is very wicked on the part of some people. When we take public transport to work, okay, public transport out here is very comfortable, so please don't start getting scared for me. It's a very comfortable ride, and as a nurse, everything is free. It's sad that it took COVID-19 to make everything free for us nurses, but thank you, we appreciate it. Anyway, the panhandlers, the beggars are getting so vicious, the homeless people. If you don't give them something, they cough on you. Can you imagine that? So please remember, wear your face mask, stay away from people who are coughing, social distancing and all that, all right? Don't forget your steam treatment. It helps, okay? Have I forgotten something? Is there something they asked that I forgot to talk about? Do you have any questions or comments? No, I don't see any questions or comments. Hello there, Divine Oracle. Hello to you, Nkosi. Hello to you. We love you, Regina. I love you too. Thank you to all my fans. I've been getting your messages. I've been getting your prayers. Oh my goodness. You think that these things go unread? No, they don't go unread. I read them, and it's so touching. And I want to say thank you. All right. They boost the morale. They encourage us. And you know what else they do out here? McDonald's gives us free coffee. You know, it's called like a thank you pack. They give us free coffee and free food. So if you're a nurse and you have your ID, you go in there, McDonald's will give you free coffee and free food. What do they call them? These people, they send us burgers, you know. These natural foods people, they send us burgers at lunchtime, send us drinks. The hotels, if it's too late and you don't want to travel all the way home, you can show your ID and crash in a hotel so you can be at work the next day. Believe me, the hospitals really need a lot of help, and we are doing our best where we are there for them. Thank you for your encouragement and thank you for your prayers. Please keep them coming. Keep them coming. When I come from work and I get on Instagram and I read from my son Alex, who's from fooling out there, I quite enjoy your entertainment. Thank you so much. And I read from I Am Tones and I Am Tony Tones, and you know, all of you that have been entertaining us on Instagram. This is the way to, you know, encourage each other and keep each other going. I would like to say thank you to all of you. Thank you for watching. And if you have any questions, please send them over. I'll be on hand to answer. And thank you very much. Have a beautiful day and stay COVID free. All right? Thank you. I don't know how to turn this off, Tisa. Please come help me. I can see your head. End.